The third presenter in this series related to the alternative methods for pain is going to be Dr. Mark Sobor, and he comes to us just with a wealth of knowledge. And he's been helping people deal with different ways to treat their pain for over 25 years, and we're happy to have him here. So please welcome Dr. Mark Sobor.
Good morning. I've been treating pain for over 30 years. I'm a board-certified family practitioner, and early in my career, statistically, the second most common reason for a patient to see their physician was pain. The number one for their primary care physician. Number one reason was upper respiratory infections. So in my training, they taught me how to give the pill. If that pill didn't work, to give another pill. If that pill didn't work, then maybe do a test. And if that didn't work, send them to a specialist, which to me was nonsense. So after I've known a patient for a little bit, invariably they're going to ask, "Doc, why am I hurting so bad?" And I always tell them the truth. God's punishing you for your sins. And then the patient says, "But Doc, I don't sin." I go, "Well, if God's going to punish you, you might as well start sinning." Don't tell that on the first visit, because I don't know who I'm talking to. So, why are they hurting? Why is it that when I was 15 to 19 to 20 to 22 years old, I could play a game of basketball, I could sprain one ankle, I could play another game, I could sprain the other ankle, I could finish 2 more games. Now I sprain an ankle and I'm crippled for 2 months. I'm 63. Here's the deal. Between 30 and 40, you lose 8% of your muscle mass. That's why by the time you're 35, 36, by the time anybody is 35, 36, 37, you don't see a professional player at the top of their game. They're not as fast as they used to be. They're not as quick as they used to be. They play smart. Everybody says, "Oh, wow, that's a smart player." Yeah, because you can't run as fast anymore. So you lose 8% of your muscle mass between 30 and 40. You lose 8%, another 8% between 40 and 50. Between 50 and 60, you lose 20%. That's why when you talk to people, when I used to talk to people, they say, "Wait till you get to be 50. And then the 50-year-olds would say, or 60-year-olds, "Wait till you get to be 60. That's what they're telling you. 40% of I have lost 45% of my muscle mass. Okay? What does that mean? Well, that means that structure when you were 20 and 25, you got away with just beating the hell out of yourself, and you just got up and you did it the next day. Okay? Because the muscle structure was there to keep the bones together. I treat musculoskeletal pain. And that's why I love physical therapists. Physical therapists, my buds, they're the only ones I can ever talk to. I basically know every muscle in the body. I know what all the muscles do. Guess what? They did a study of orthopedic surgeons, and they didn't know what muscles they were working on. Let me give you an example of an understanding of why you need to know what every muscle does in the body and how it functions. I had a patient, worked in the hospital where I worked. She came in and she said, for 1 year, this is as far as she could raise her arm. And I said, "So what have you done?" She saw the orthopedist. He injected a muscle, and she still had pain and she couldn't raise her arm. And he said, "Come back in a month and we'll do surgery on you and clean it out." If you go to a surgeon and he doesn't tell you what the hell's wrong with you, he's going to tell you you're going to clean it out, run from that guy. He has to prove to you you've got a torn tendon, you've got a torn ligament, something is torn, something has to be sewed up, okay? You don't clean anything out. There's nothing to clean out, except he was going to clean out the wallet, obviously. So she can only raise her arm this high. He gives her an injection. What muscles control the raising of the arm from this level to this level? The rotator cuff muscles. What's a rotator cuff tear? There's 4 muscles in the rotator cuff. Only one muscle is torn. The orthopedists only care, if there's an orthopedist in here, I'm sorry. The orthopedists only care about one muscle, that's the supraspinatus that comes over the top, goes under the bone, attaches here, and from 90 degrees it goes up. If that's torn, now they got an operation to do. That's all they care about. That's all they inject. So what did I do for her? I treated the other 3 muscles. Guess what? One treatment, she raised up. She was done. It was over. I said, go to physical therapy because you haven't been doing anything for a year. She never went. Whatever. Can't force anybody, right? So my job is to release muscle spasm or a myofascial pain. I do trigger point therapy. I do acupuncture. I do traditional acupuncture. And I do deep tissue acupuncture or what's called dry needling. And my presentation will show what that's all about. So, why did I start doing acupuncture? Why did I want to get involved in alternative medicine? Why did I go to the dark side? We're talking, I started in '89. I'm from Illinois, actually from Michigan. There were no acupuncture schools that were licensed in Illinois until 1995. There were people who were being trained in acupuncture in Illinois, and they were being raided by the FBI, practicing medicine without a license. Also, Illinois or Chicago is the home of the AMA. So what happens in this country is, in California, in '89, they were already doing acupuncture, and insurance was paying for it 20 years before that. Then the East Coast, and then finally the Midwest. We're very conservative, we take our time, and it's good and bad. So, I'm a chronic pain patient. I did martial arts as a kid, played football, played basketball, I was a paratrooper. I just trashed my knees. And in 1989, I had a doctor do acupuncture on my knees, and it was amazing. It was really, really good. And I'm like, okay, I'm going to learn this stuff. And so I learned acupuncture first, then I learned trigger point therapy. The problem with trigger point therapy was people don't do trigger point therapy anymore. So I had to learn it from massage therapists that would do deep tissue. I learned this from massage therapists. And then I just started doing needling, and I started doing injections. I get tremendous results. By balancing out the musculoskeletal system, you can just about treat everything. All right, what'd you do with my thing? Okay, so we're going to have a presentation. We're going to talk over what trigger points are. Now, I treat the whole body. I treat every single part of the body using these techniques. But here we're going to talk about migraine headaches and muscle tension headaches. Every single patient that comes to my office they say, I have a headache, I have a migraine headache. Every single patient. What percentage of people have migraine headaches? 8, maybe 10%. So that means out of 10 people that come into my office, only one of them has a true migraine. What do the rest of them have? Muscle tension headaches. So in my training, they always told me to, make sure the patient doesn't have a migraine headache. Why? Because there's a pill for it. There's a very good pill. Imitrex is a great pill for a migraine headache. There are no pills for muscle tension headache. So why talk about it? Just because 90% of people with headaches have muscle tension headaches? That's their problem. And I'll tell you right now, doctors are very poorly trained in the treatment of pain. Like I told you, it's the pill, which is like moronic. Give me a break. Come on. You're going to go see your doctor, he's going to give you ibuprofen. You get your own ibuprofen. Do they teach you exercise? They don't teach you exercise. They don't teach you stretches. They don't teach you anything. I'm sorry. I'm really getting going now. So this concept of tender points, of muscles that are in spasm, muscles that hurt when you push on them, muscles. Now, a trigger point, by definition, a trigger point is an area of hyperirritable tissue that causes local pain or at a distal site. The other day, a woman came into my office, and she had eye pain. And she was put on, right away they told her that she had She had trigeminal neuralgia, which is like one of the most horrible things you can get. People literally, 10% of people with trigeminal neuralgia commit suicide. It's this horrible, it's called a lancinating pain that just kind of like shoots through your whole face. And so she comes in, she's got eyeball pain, and I'm talking to her, and she's like, I go, how long have you been having headaches? Oh, 4 or 5 years. This eyeball pain just started. And I said, where were the headaches before? She goes, like here. I go, well, to me, that's the same thing. The pain is from the same area, from the back of the skull. That's where the pain is. That's where the trigger is. You don't treat this, you treat here. You treat where the trigger is. So there's a trigger in the back at the base of the skull called the occipital notch. You treat that, you make this pain go away. It's magic. So obviously the primary care physician didn't know anything about trigger points, didn't understand how the muscles work, and they put her on carbamazepine, which is an anti-seizure medication. Shock and dismay, it didn't work. And she's walking around with eyeball pain. She works a normal job, 8 to 10 hours, works hard, can't take narcotics. So these tender points that I'm describing, which are trigger points in English, in Chinese, in Japanese they're shi points. I guess they say shi when you push on them. And then Kori points, I think, are either Korean or Chinese. And we have our trigger points. Trigger points are no longer popular. Nobody talks about trigger points in modern pain medicine anymore. There's a couple of old guys, way back when. But trigger points, because in modern medicine, if you have pain anywhere, it has to be a nerve. And you have to treat the nerve. It's got to be from the neck. It's got to be someplace. It has to be a nerve. That's the entire basis of modern pain medicine, is treat the nerve, kill the nerve, cut out the nerve, cut off the head, do whatever you have to do. So now here are the types of trigger points. Myofascial just means muscular. Cutaneous, I've had like 2 patients who literally their skin hurt when I pushed on it. Fascia is important. When you take a chicken apart and you see the muscles, you take one layer of chicken off, and then there's this like shiny, very thin, that's fascia. What does it do? It lubricates in between the muscles, so when one muscle is contracting, the other one's relaxing. And fascia is electrically charged, so I do a lot of myofascial work, muscular and fascial. Ligaments are the attachment between a muscle and a muscle. Tendons are, what? Wrap it up. I just got started. Okay, so here's what actually happens. So you injure yourself, or you have a repetitive stress injury where you're typing all the time and your fingers start getting numb, okay? Your fingers are numb. Obviously, you have carpal tunnel. You need surgery, right? No, how about this? How about those muscles that you're using to flex those fingers all the time? Let's treat those. You can treat 50% of those patients who have carpal tunnel symptoms, and they go away. And you teach the patient to stretch and strengthen, and they're fine. But you make more money doing surgery. So, repetitive stress injury, trauma, where you sprain an ankle and the muscles above the ankle get injured. And so what does the muscle do? It goes into contraction. Now, imagine your biceps muscle, this one's totally relaxed now. The fibers are completely open. When I do this, the fibers come closer together. What happens when I injure that muscle and the fibers are here? Well, first of all, I'm not going to have any strength. Second of all, I'm going to be walking around like this. And then I'm going to have pain here or here, because that's the attachment of this muscle. That's it. That's what this is about. And this is just a demonstration of, the bottom one's really nice because that would be the quadriceps muscles that attach to the kneecap, to the patella. So there's your triceps. Now I'm going to start treating headaches. So there's the triggers for this part of the face. I always have to pay attention. The trapezius muscle, the anterior component, those X's is what has to be treated. You don't do anything to the face. You could like beat the face with a sledgehammer. It's not going to change anything. Well, they'll have more pain, obviously. But put needles in there. I put needles in there. I release the muscles, and I inject them. 100% cures. Now, the back of the skull there, those are the occipital notches. What this is showing is that 70% of trigger points in the human being are also acupuncture points, which I think is really interesting. I have had patients come to me with headaches for over 20 years. They've been to the Mayo Clinic. They've been all over the world. I inject those 2 spots in the back of the skull, or 1 spot usually because it's a very powerful treatment. Headache's gone completely. Completely. And this is just another example of trigger points and acupuncture points. This is a doctor's presentation, so you guys are going to have to get smart now. They describe, this is the sternocleidomastoid, this thing that sticks out. I never had a lot of luck with that one. Every once in a while. And again, this is just, the most important thing that you learn from this is don't, like I told somebody the other day, wrist pain. People come in with wrist pain. X-ray the wrist. Do everything you want to the wrist. Everything's completely normal. They have wrist pain. Magic. We don't know where it is. It's the muscles. Treat the muscles. Everybody wants to treat the area that hurts. You have to understand what a trigger point is. So I do acupuncture first. This is an injection of the trigger point. Okay, this is a really good movie. It's me torturing my wife. It's a lot of fun. She had horrible headaches for a long time, actually the back of the skull and the traps. And this is just going to show you what a treatment looks like. Now, my acupuncture hurts. People walk in and say, acupuncture doesn't hurt. Well, yeah, that's if you just touch the needle. No, I'm digging in there. I'm getting that muscle to release. But it works great. Well, I basically tell the patient, I can do 10 treatments on you with traditional acupuncture, and I could do 2 treatments or 1 treatment on you today, and you'll be cured. Nobody wants to come back 10 times. So I'm basically saying my wife has had, there goes. I'm having this pain, it's bugging the hell out of me, and my doctor is no good, and my husband's an idiot. And that's exactly what she's saying. And I can't stand him anymore, but I let him do this to me because it hurts so bad. Okay, so now I'm pushing on the trapezius muscle, and it's very tender. And sometimes they actually describe, and that's how the trapezius muscle goes. If you remember the previous picture, it goes all the way to, that's where it ends, and it goes up into the skull and into the skull area. And so now I'm pushing on her because I just want to hurt her, because I want to just teach her a lesson. Can you stop it? Can you stop it for a second? That's the occipital notch. Now, she doesn't actually have frontal headaches, but she has a lot of pain in back. So, you know what the ideal marriage is? A deaf husband and a blind wife. Okay, continue. So now I'm looking for the triggers, and I'm going to push hard. Now watch this. Bam. Now, I don't manipulate that much there. There isn't a lot of tissue there, but that's a very powerful acupuncture point, and that's the actual area right in the occipital notch that will give you all these headaches or a lot of pain up in the back of the head. There. When she jumps, that's a positive jump sign. Actually, it's not, but... See, now that's the other muscle. That's the other muscle that gives you the pain on the side of the head. She just had all this back, neck pain. It's really funny because I did probably 6, 7 treatments like this. She doesn't complain about this anymore because I think she's scared of the treatments. So now the traps, what I'm going to try and do is I grab the muscle And I can actually feel, and the patient feels the muscle jump. And that's a positive jump sign. Because the muscle's in spasm, and I'm trying to create a counter-irritant to make the muscle release. And this is the only thing that'll do it. You can't massage this out. You can't, the only thing is the counter-irritant of the needle. See? I'm trying to get a release of the muscle. Once there's a release, that's it. That's the cure. And she hates needles. She can't stand needles, but because she has so much pain, she's so stressed out that she lets me do this to her. I've been doing this for 30 years, so I'm actually feeling the tip of the needle as it's hitting the muscle, and I'm moving the tip of the needle. I know exactly what type of tissue I'm going through. Yeah, it looks brutal as hell, doesn't it? But I'm telling you, 2 treatments and pain that you've had for 5, 10, 15 years is gone. Because afterwards, I teach you how to take care of yourself. You know, you sleep properly. Okay, here's a very important thing. I will not do this to somebody who's not sleeping properly. You need to have 4 to 5 hours of uninterrupted sleep, because at that point, that's when the muscles completely relax, the muscles paralyze, and the muscles reset. If people are up all night or waking up every hour, I won't do this, because I'll hurt them, and then it just all comes back. You have to sleep. So proper sleep can help a lot. So I release the muscles, I leave the needles in for 10 to 15 minutes, and then I inject those same exact areas using a combination of lidocaine with normal saline and a tiny, tiny bit of steroids. I use almost no steroids, but if somebody's had so much pain for so long, I consider that to be a little bit of an inflammatory effect. And also scarring. This tissue gets so hard, and so in Chinese medicine, they actually call people who have, she didn't have this, but they describe them as wooden shoulders. They're so tight that it feels like you're touching wood. Because then I'm just going to inject these areas with the solution. And when I would do this treatment on her, she was like really, really good for a couple of weeks. And, you know, and then over time, she would need another treatment. So what I just showed you is what's unknown in modern medicine, how to treat muscle tension headaches. This is the correct way. If you want to treat muscle tension headaches in modern medicine, they're going to give you a muscle relaxant that doesn't work. The only thing muscle relaxants do is help you sleep. You know, maybe a narcotic, maybe something else, and you basically just walk around with this muscle tension headache until somebody finally teaches you how to get a massage, how to treat this yourself, how to roll around on tennis balls, how to use a back knobber, which is what I do. Every one of my patients, I do these types of treatments: acupuncture, muscle release, injection, and then stretch and strengthen. Every patient has to stretch and strengthen, which is also a protective mechanism for me, because I know they won't, and they'll always come back. And when they come back, I'll say, "Did you stretch and strengthen?" They'll go, "No." Okay, now I can go? Yep. All right, now I'm going to show you guys magic. I've been doing this for 30 years, and after 30 years of looking at things and trying to understand things, you start to see things in a different way. Like everything is like, it's no longer even 3-dimensional. It's like a 4-dimensional. You're like in a different plane. I'm kidding. God, you guys are so serious. All right, so here's a guy who walks in with Achilles tendonitis. Soccer player, and it's written there, I think he's like a 34-year-old guy who had trouble running anymore, And so first thing is the Achilles tendon. Treat the Achilles tendon. No, you treat the muscle that creates the Achilles tendon. There's the muscle. There's the trigger points that create the Achilles tendonitis. I don't touch the tendons, especially not the Achilles tendon. Sure as hell I'm not going to inject it. You're never supposed to inject with steroids the Achilles tendon. Damn thing will really rupture. So now I do the acupuncture on him. And I think I did 1 or 2 treatments on him, and then I didn't see him. Then he showed up like a year later. I go, what happened to your Achilles tendon? He goes, nothing. I went out and played soccer right away. Literally 1 week after I treated him. So this lady walks in. She's got her left ankle is swollen. You can see it was broken at some point. And she's 68 years old. She works for Walmart, so she's on her feet all day. And, of course, they abuse the hell out of her. And so here's a treatment of these muscles. So what am I treating? I'm not going, this one I will go for the ankle joint because she has arthritis in that ankle joint, and she has degenerative changes, and she's been walking around on this, I mean, it did heal properly, but I do a combination. I do a muscular component treatment, and I do the ankle treatment. So now I'm doing electrical stimulation, so acupuncture with E-stim to loosen the muscle that controls the movement of the ankle. And then I inject it. This is a good one. So this young girl, 26-year-old girl, comes in, and I've known her since she was 9 years old. And she was in a car accident, and she's got horrible knee pain, okay? She's had 3 arthroscopies before this on her knees, and she would always have the same knee pain. Now, she was in this again, remember, I'm talking about trigger points, and when I start saying trigger points and when I start saying pain, you think to yourself, which muscles are involved? Even though I'm saying knee pain, right away you're thinking, which muscles control the movement of the knee? So I'm pushing on the quadriceps, the big muscles in the front of the body here. So I'm examining her, and I'm thinking to myself, the accident wasn't that big of a deal. I've never really seen knee pain. I mean, unless you crack your knee. But it wasn't. It was like a 20-mile-an-hour accident. And it didn't make any sense that she would have knee pain, so I started examining. And then I said, what sports did you play? It was volleyball. So she's in this position, okay, constantly under pressure, constantly under stress, so her quads are messed up. She's got a myofascial holding pattern in her quads. So am I going to treat the knee? What am I going to treat? There you go. You know it. You're the only people that know this. Doctors don't know this. There. So I drew a line. Now, she doesn't like needles either, so I treated the 2 middle muscles, the rectus and the intermedius. I stimmed her up. She hated this too. And these are your trigger points. 1 treatment, she was done. No more knee pain. Knee pain completely gone. Never needed x-rays, never needed anything. Never had to touch the knee. You treat the muscles. You balance out the function of the muscles. When I do a shoulder exam, raise up, behind, here, across, you're fine. Okay? But invariably they'll go, I'm fine. No. Or the best one was, I go, so what are you here for? Oh, for my back. So I checked her shoulder. I go, move your arm. She goes, yeah, I can do everything with it. He had a frozen shoulder. This is a really interesting case. This guy crushed his finger 20 years earlier. And all the bones were just shattered. And he had beautiful surgery. Everything was put back together, but that's as much as he could move it. So what I'm going to describe now is the treatment of scars. Now, this is obviously an internal scar. So this is after the first injection. You saw how much he could move it. That first picture is as much as he could move it. After his second surgery, to help him move it. Didn't get any more out of it. So that second picture is me injecting the joint itself. That's how he moved it. The next one is after the second injection, third injection. Just break up the scar. It's not a big deal. And I treat scars everywhere, all over the body. When I was in my training, they would say, any scar anywhere, you have to inject it. So this guy walks in. I've been taking care of him for a while. This guy just got, I think you call this PPP, piss poor protoplasm. He, everything was blocked. Carotid arteries, coronary arteries. The guy's 52 years old. He's had bypass. Poor guy. I mean, he was a smoker, but still. Anyway, he comes into my office 4 days after open heart surgery with chest pain. I go, what the hell's wrong with you? What are you doing in my office? He just had open heart surgery. He goes, I just went to the cardiologist. He hasn't slept in 4 days because he was having horrible chest pain. He took 5 Vicodin that night, and he still couldn't sleep. Okay, guys. Which muscles? Pectoralis. Bingo. You got it. I sure as hell was not going to mess with this scar. I mean, goddamn, 4 days old. I wasn't going to, there's no way in hell I was going to get near that scar, but I knew that there were trigger points here somewhere. And so I went ahead and I released the trigger points. The pain was gone immediately. He slept. He was taking no medications. This is a lower back thing. All right, so this patient had hernia surgery. And I actually drew a little line to show where the surgery was perfect. You can hardly even see a scar. But he comes in with abdominal pain after hernia surgery. Why does he have pain? The abdominal, the rectus muscles are in myofascial holding pattern. He's got trigger points. And of course, see, primary care physicians should know this because the surgeon doesn't care. The surgeon looks at this, he goes, the wound is healed, there's no infection, he's alive, I won. Okay? He doesn't care if the patient has any more pain. This is out of his league. So he winds up going to the primary, to me, I'm his primary care physician. This happens to every primary care physician and nobody knows what to do. Maybe they give opioids, I don't know. Oh, opioids. I don't give opioids. The last time I gave opioids was somebody walked in with a herniated disc. I gave him for 7 days. Get him out of crisis, get the pain under control, get the swelling under control. I can treat a herniated disc, unless it's a fully blown, like completely out. But out of, let's say, 100 herniated discs that typically would get some kind of surgery, in my practice, maybe 1 will go, because the body will heal itself with some help. So this is a different E-stim. This is a hand E-stim machine. And then I injected the scar, because this is like 2 months. I mean, he was having this abdominal pain for 2 months. 1 treatment, he's done. This is a nasty scar. This scar was this big. I didn't even take a picture of it originally because I didn't think I could help this woman. And it basically almost went to the bone. And she basically couldn't sit, she couldn't lay, she couldn't do anything. And I think what they actually did to her, this is on her butt, what they actually did to her was when you're in surgery, they put a grounding pad under you, it's called a bovie, and she had surgery for a brain tumor, so she was in the OR for like 7 hours, and I just think they burned the hell out of her ass. And I didn't know what to do. I was like, okay, I'll give it a try. And I just started doing a little bit of gentle acupuncture. She got better. And then all of a sudden it started healing. I'm telling you, magic. It's magic. Any questions? Who's going to make money off of this? You realize we live in a capitalist system? You know who used to know the stuff I know and used to do the stuff I did? Physiatrists, PM&R doctors, doctors of rehabilitation. There weren't many of them. You know what happened to them? They became invasive pain specialists. The newest specialty that there is now, and an invasive pain specialist takes the same patient that I get out of back pain with a $200 shot, they take him into the operating room, they give him anesthesia, they use a fluoroscopy, all of a sudden it's a $5,000 procedure. And all they have to do is see 5 patients a day, and they made a ton of money, and you get a group of pain medicine, invasive pain specialists into your hospital. It'll bring up the bottom line by 7%. So what do you think they're going to do for me? It's capitalism, man. Anybody else? Yes? Is what? No, Medicaid doesn't pay for anything. I think the last time I tried in Chicago, and this is like 15 years ago, I think Medicaid was giving me like $2 for 93 cents. There you go.
She also asked if there's any, I'm right here, Doc, if any insurance typically would cover your service.
This is the way I do it in the office. I'm an MD. I belong to all insurances. The insurance covers for the visit. They cover for the injections. For the acupuncture, the patient pays $40 out of pocket. So I try to keep it reasonable. But you guys, it's a special $75. I was actually going to bring needles here, but my girls failed me. And actually, in these presentations, I would inject heads too. If somebody had a headache and it was occipital, I would inject you and cure you right now. Too late. I don't have a shot. Next time. Well, come up here. Come up here. I'll just examine her. What's your name? Sylvia. I'll just examine her, and I'll tell you right away if this is... Come on up here.
While you're examining her, can we have a question, Doc, at the same time? Okay.
Side?
Dr. Sobor.
Right here.
Yeah, hold on. Let me just go to the front.
Maybe. Mm-hmm.
Right there.
Yep.
Okay, that's it. This is the cure. One shot, she's totally cured. It's gone. Everything's gone. All pain is gone. Now, feel this side. Give me your hand. Feel that notch.
Yep.
No. You go up here.
Mm-hmm.
Feel that?
Yeah.
Okay. Here's the other side. And then you can actually feel not so bad, right?
Actually, that hurts more.
Oh, well, there you go. You need 2 shots. But literally, how long have you had this?
A long time.
Yeah. This is what everybody comes in with this. This is not, you can't massage this out. You can't. The injection is the cure. The counter irritant is the cure. I literally cure this stuff. Yes.
Hold on, we
I
got
do
a
cupping. I've
question
done
we've been
cupping.
waiting for over this way. I have a microphone, you guys. Well, if you raise your hand, we have 2 waiting right here. Dr. Sobor, to your right.
Yes.
Go ahead, ma'am.
Dr. Sobor, I just wanted to ask 2 questions, really. Do you work with any of like addictions, like eating or smoking or anything like that in your acupuncture?
No.
No. Okay. Question number 2, do you have a list where we can sign up to come see you today?
Of course. There's my staff.
I had a
So
question.
basically, and the most important thing is that you're going to learn what this is. That lady came up, and she had no idea why she had this pain, and she's gone to her doctor a bunch of times, and now I just showed her what it is. And if you massage that area, I'm sorry, what's your name again? Sylvia. If you massage that area with your thumbs, here, everybody do this. Okay, put this into the notch in the back of your head, grab your head, and start massaging it. That's how you can actually treat this yourself. Very, very effective, especially if you catch it early. Well, you didn't bring one, so they don't know what that is. And this is what I teach. So I teach the patient self-care. Everybody has to know self-care. And everybody has to stretch. Now, this area here, you don't really strengthen per se. This area up here, the neck and the head and stuff, majority of that occurs from bad ergonomics. So you're at the computer, you're looking up, you got your screen up here, whatever it is. Stress, obviously. Stress is the #1 cause of everything. But I mean, I always want to pay attention. Why patients, I treat the patient's back. I know for sure they're better. They come back 2 weeks later, back hurts exactly the same. I go, you're kidding. So I do it again. Then they come back again. I go, how do you watch television? I lay on my side on my couch and watch television. Their spine is like this. No, you have to sit in an ergonomic position. You have to have a lumbar support. You have to buy a nice lounger, recliner to support your back. Your back is weak. These are things that people don't think about.
All right,
Mattress, how long can you keep a mattress? 7 years. After 7 years, you have to replace your mattress. What? Well, that's why you're going to have back pain when you get older.
All right, we have another question over this way.
Yes, sir.
Ma'am.
I just was wondering, how does somebody come to see you? Does your office take self-referrals or?
Oh, yeah. I'm a primary. Yeah, you just come in.
Thank you.
Call up, make an appointment. And usually same day. Yes.
Dr. Z, do you want to come up to the stage as well, please?
Do we do Veterans Choice? Who else?
They raise them.
Who? Yes, ma'am. Oh, that's easy. Like, real easy. Because it's always misdiagnosed. Anybody who has lower back pain and it shoots down the leg a little bit, I got sciatica, I got lumbago, they just come up with the word. Sciatica is to lower back pain what migraine is to headaches. Out of all the people that say I have sciatica, probably only 15% have true sciatica, which means the nerve coming out of L4, L5 is being pinched on by a disc, causing pain shooting down, and the pain has to go to the feet, has to go to the toes. If the pain in your lower back, as much as it could possibly hurt, does not go below the knees, there's no nerve involvement. It's all a quick fix. You just have to know how to do it. And I know the secret.